Derek Mounsey here, welcome. I've got 3 topics today that I want to talk about. I'm going to try to cover them fairly quickly. So the 3 topics are setting expectations, data accessibility, and marketing. And I speak about these all in terms of healthcare. So the first one, we'll talk about setting expectations. And this came to me recently in a visit to an urgent care clinic because I had what I thought to be was a sinus infection. So I walk in, I've been around, my whole family had a sinus infection, or so they thought, for the past beginning, and so that's kind of what I figured I had. So I went into this urgent care clinic expecting to get a Z-Pak or something in order to take care of that sinus infection. So I sit down with the nurse practitioner, tell her my symptom, tell her what's been going on, and she comes back to me with the fact that she doesn't believe I need a Z-Pak, and she thinks it's just a common cold, and she wants to treat the symptoms of it and let it kind of run its course, because that's the only option really available. And so, I greatly appreciated her honesty and her thoroughness in explaining this to me. So then she ran with that a little bit and said, just because sore throat was one of the key symptoms that I was showing, was that she was going to do a strep throat test. And then when the strep throat test came back negative, she said she was just going to send it off to the lab to have a culture ran just in case. And so at that point in time, it gave me a little bit of pause in the fact that I had a negative strep throat test, but she still wanted to send it out to the lab. So I figured there's going to be some cost associated with that, but didn't ask, didn't really inquire too much into how much the cost would be. So she sends me away. I go treat the symptoms of that. Use her with recommended over-the-counter medications as she suggested, and treat the symptoms of that cold, and it ran its course and was fine. So 2 weeks after, I get a bill for it's about $160 for that culture that they ran in the lab. And my first thought was, I was a bit surprised because I wasn't expecting, although I kind of at the time gave pause and knew there would be a cost associated with it. For some reason, I didn't fully click. And so with myself, being in healthcare and knowing that there's a cost associated with everything, and still somewhat being a little bit surprised, it makes me think from the patient perspective, from the unassuming patient, how much shock and maybe all that they may get, that that doctor visit where they paid their $20 copay, wanted to get some medication from the physician, wasn't prescribed anything, and then they end up getting a bill for $160 for the services rendered, and how that would eventually probably affect patient satisfaction. So had I had I been given the expectation that, hey, if I run this culture, you're going to have some sort of bill associated with it, and it's going to be over $100, less than $200, just setting that expectation for that patient, at least some type of ballpark that there will be a cost associated that they'll be responsible for, I think is going to be crucial in order to raise satisfaction scores. And I honestly don't believe that healthcare organizations are fully going to get a grasp on patient satisfaction until they can give that patient some type of upfront cost estimation as to what they're actually going to pay. So I'll leave that with that. The second topic that I want to talk about is accessibility to data. I'm working on, one of the projects I'm working on revolves around healthcare disparities, and to really see if there's a healthcare disparity, you need the data to show, to be able to look at this outcome data or the readmissions data or the hospital-acquired conditions data and filter it by socio-demographic categories. And what I'm finding is that while this data exists, it exists in somewhat silos that are kind of difficult to mesh together. So, and the fact that I'm doing this and having a pretty good struggle with it makes me think to believe that it hasn't been done a whole lot before. So that's just one thing as we move towards population health. The accessibility to the data that we need is going to be really the critical factor that defines our success or failure in this population health initiative. So then the last topic I want to briefly touch on is marketing in healthcare. And I kind of have a personal interest. It's just something that kind of piques my interest, and that's marketing. That's selling your organization versus other organizations, or your mission to your customer base. And it's something that in healthcare, while you're starting to see it more, and there's always been the commercials and the billboards. I don't know, at least at our institution, I don't always feel that we're doing enough, I guess would be. I really think there should be a pretty good emphasis on the marketing component of healthcare, attacking not only the traditional forms of marketing, billboards, commercials, radio ads, but really expanding your horizons into this new social atmosphere, the Facebook, the Twitter, the blogs, the vlogs, the YouTube. So really expanding our horizons on that, and increasing not only our presence in terms of word of mouth and physical advertising, but really increasing the robustness of our e-presence. So that's something which I think we're developing, and I think other organizations are starting to realize that those retail, as we move towards kind of more of a retail type market, that we're going to have to put more funds and more focus and more efforts into making sure that we are selling ourselves, not necessarily our services, but selling who we are, because I think that's a big, a big factor for individuals, is that you obviously have to make sure they're aware of the service that you provide, but why should they come to your hospital as opposed to somewhere else? So those are kind of three things that have been on my mind recently, and have come to the forefront of what I've been doing and been focusing on, and I think they're important. To be successful in healthcare. Thanks again, and I'll talk later.